A 45-year-old female client, with a history of chronic corticosteroid use, presents to the clinic with complaints of weight gain, a moon-shaped face, and purple striae on the abdomen. The nurse suspects Cushing's syndrome. Which assessment finding would further support this suspicion? A. Hypotension. B. Hyperkalemia. C. Hypoglycemia. D. Hirsutism. The correct answer is D. Hirsutism. Explanation. Cushing's syndrome is characterized by excess production or administration of corticosteroids, leading to a hypercatabolic state. The classic clinical manifestations include central obesity, moon-shaped face, and purple striae on the abdomen. Among the given options, hirsutism, excessive hair growth, is a common manifestation seen in Cushing's syndrome due to increased androgen production. Hypotension is not typically associated with Cushing's syndrome. Instead, hypertension may be present due to mineralocorticoid effects. Hyperkalemia and hypoglycemia are not commonly seen in Cushing's syndrome and are more indicative of other endocrine disorders. A 38-year-old male client is admitted to the hospital with suspected Cushing's disease. Which laboratory finding would be consistent with this diagnosis? A. Increased adrenocorticotropic hormone ACTH levels. B. Decreased urine-free cortisol levels. C. Elevated serum potassium levels. D. Decreased serum glucose levels. The correct answer is A. Increased adrenocorticotropic hormone ACTH levels. Explanation. Cushing's disease is caused by excessive production of ACTH by the pituitary gland, leading to increased cortisol secretion by the adrenal glands. Therefore, increased levels of ACTH would be consistent with Cushing's disease. Urine-free cortisol levels would be elevated in Cushing's syndrome, not decreased. Elevated serum potassium levels, hyperkalemia, and decreased serum glucose levels, hypoglycemia, are not characteristic findings in Cushing's disease. A 50-year-old female client with Cushing's syndrome is scheduled for an adrenalectomy. The nurse is providing preoperative teaching. Which information should the nurse prioritize in the teaching plan? A. Importance of maintaining a low-sodium diet postoperatively. B. Administration schedule for oral corticosteroids. C. Techniques for preventing surgical site infection. D. Potential complications related to adrenal insufficiency. The correct answer is D. Potential complications related to adrenal insufficiency. Explanation. Adrenalectomy involves the surgical removal of the adrenal glands, which results in the loss of corticosteroid production. Therefore, the nurse should prioritize educating the client about potential complications related to adrenal insufficiency, such as Addisonian crisis, which can be life-threatening. The client will require lifelong replacement of corticosteroids postoperatively, but the administration schedule can be covered in subsequent teaching sessions. While maintaining a low-sodium diet and preventing surgical site infection are important aspects of postoperative care, they are not the primary focus for a client undergoing an adrenalectomy. A 32-year-old male client with Addison disease is admitted to the emergency department with severe fatigue, hypotension, and electrolyte imbalances. The nurse suspects an Addisonian crisis. Which laboratory finding would support this diagnosis? A. Increased serum sodium levels. B. Elevated serum glucose levels. C. Decreased serum potassium levels. D. Low serum cortisol levels. The correct answer is D. Low serum cortisol levels. Explanation. Addisonian crisis is a life-threatening condition that occurs due to a severe deficiency of cortisol and aldosterone in individuals with Addison disease. The most important laboratory finding in an Addisonian crisis is low serum cortisol levels. Addison disease is characterized by decreased cortisol production, so the levels would be low during a crisis. Increased serum sodium levels, elevated serum glucose levels, and decreased serum potassium levels are not specific findings for an Addisonian crisis. A 45-year-old female client with Addison disease is prescribed fludrocortisone acetate. Which statement by the client indicates an understanding of the medication's therapeutic effect? A. This medication will help control my blood pressure. B. I will take this medication to reduce my blood sugar levels. C. The medication will decrease my risk of infection. D. This will help me manage my weight and appetite. The correct answer is A. This medication will help control my blood pressure. Explanation: fludrocortisone acetate is a synthetic mineralocorticoid prescribed for clients with Addison disease to replace the deficient aldosterone. Aldosterone plays a key role in regulating blood pressure and electrolyte balance, particularly sodium and potassium. Therefore, the correct statement regarding the therapeutic effect of fludrocortisone acetate is that it helps control blood pressure. It does not have a direct effect on blood sugar levels, infection risk, weight, or appetite. A 28-year-old male client with Addison disease is receiving education on self-management. Which precaution is essential for the client to follow to prevent an Addisonian crisis? A. Avoiding high-sodium foods. B. Increasing physical activity gradually. C. Limiting fluid intake. D. Taking medications with meals. The correct answer is D. Taking medications with meals. Explanation: Addisonian crisis can be triggered by stressful events, infections, or sudden withdrawal of corticosteroid medications. Therefore, it is crucial for clients with Addison disease to take their medications as prescribed, typically with meals, to maintain stable cortisol levels. Avoiding high-sodium foods, increasing physical activity gradually, and limiting fluid intake are important for overall health but are not directly related to preventing an Addisonian crisis. A 6-year-old child with asthma is prescribed inhaled corticosteroids to manage their symptoms. The nurse educates the parents about the potential side effects of long-term corticosteroid use. Which manifestation should the nurse explain as a possible sign of adrenal suppression in the child? A. Weight gain. B. Hyperactivity. C. Hypertension. D. Fatigue. The correct answer is D. Fatigue. Explanation: adrenal suppression is a known side effect of long-term corticosteroid use. It occurs due to the negative feedback mechanism on the hypothalamic-pituitary-adrenal (HPA) axis, leading to decreased cortisol production by the adrenal glands. Fatigue is a common manifestation of adrenal suppression as cortisol plays a role in maintaining energy levels. Weight gain can be associated with corticosteroid use but is not specific to adrenal suppression. Hyperactivity and hypertension are not typically associated with adrenal suppression. A 32-year-old client with rheumatoid arthritis has been on long-term oral corticosteroid therapy. The healthcare provider orders a serum cortisol level test. Which time of the day is most appropriate for obtaining this laboratory test? A. Early morning. B. Afternoon. C. Evening. D. Midnight. The correct answer is A. Early morning. Explanation: the diurnal variation in cortisol levels should be considered when evaluating adrenal function. In a healthy individual, cortisol levels are highest in the early morning and gradually decline throughout the day. Therefore, the most appropriate time to obtain a serum cortisol level test is in the early morning. This timing allows for the assessment of the cortisol's peak level, aiding in the diagnosis of adrenal suppression or other adrenal disorders. A 50-year-old client is prescribed a tapering dose of prednisone after a recent organ transplant. The nurse provides education about the importance of adhering to the prescribed tapering schedule. What is the primary reason for a gradual tapering of corticosteroids in this situation? A. To prevent adrenal suppression. B. To minimize gastrointestinal side effects. C. To reduce the risk of infection. D. To avoid rebound symptoms. The correct answer is A. To prevent adrenal suppression. Explanation: corticosteroids, when used long-term, can suppress the adrenal gland's natural production of cortisol. Abrupt discontinuation of corticosteroids can lead to adrenal insufficiency or adrenal crisis due to the sudden absence of exogenous steroids. Tapering the dose gradually allows the adrenal glands time to resume normal cortisol production and helps prevent adrenal suppression. While minimizing gastrointestinal side effects, reducing infection risk, and avoiding rebound symptoms are also important considerations, preventing adrenal suppression is the primary reason for a gradual tapering schedule. A 30-year-old female client with a history of Addison disease presents to the emergency department with complaints of severe weakness, dizziness, and nausea. On assessment, the nurse finds the client hypotensive with a blood pressure of 80/50 and tachycardic. The client also exhibits hyperpigmentation of the skin. The nurse suspects acute adrenal crisis. Which intervention should the nurse prioritize for this client? A. Administering intravenous fluids. B. Starting vasopressor therapy. C. Administering intravenous hydrocortisone. D. Initiating electrolyte replacement therapy. The correct answer is C. Administering intravenous hydrocortisone. Explanation: acute adrenal crisis is a life-threatening condition resulting from a sudden deficiency of cortisol and aldosterone. The priority intervention for a client in acute adrenal crisis is to initiate immediate corticosteroid replacement therapy to stabilize the client's condition. Administering intravenous fluids is important to correct hypotension, but corticosteroid replacement takes precedence in the management of acute adrenal crisis. Vasopressor therapy may be necessary if hypotension persists despite corticosteroid administration. While electrolyte replacement therapy may be needed due to imbalances associated with adrenal insufficiency, it is not the initial priority compared to corticosteroid replacement.